I'm Valenti. I am Chief Operating Officer of BlueSky Health. We have primary care clinics in Houghton, in the UP, as well as in Howell. We are one of the first direct primary care providers in Michigan. And to give you some personal background, I lived out of state for over 10 years, but I came back to the state I love because as an entrepreneur, I believe direct primary care is a true reform of the system. It is primary care is right now about 4% of our total healthcare costs, but yet primary care covers 90% of our healthcare needs. I ask everyone here, who do they interact with most in the medical system? It's probably their primary care provider. Why don't we try to make that as best as possible? And direct primary care does that. And the fact is that this isn't just a Medicaid problem. This is all of us, whether we have private insurance, we have no insurance. We're all, for lack of a better term, screwed. It takes over 2 weeks to get an appointment with a doctor right now. When you do get in, you wait forever, and then you get 5 minutes. They say something to you, you don't know what they said, you don't understand it, you walk out, and you're left to your own responsibility. Doctors right now have to see 25 to 40 patients a day to make a living, because with the CPT code system, 40% of their time is spent billing and coding, often with paperwork that's similar to filling out a car loan application. This means that you then only can see a doctor for a short period of time, and this is especially true for Medicaid patients. Medicaid patients, the patients that we see often have the most dire conditions. They require the most time. And with direct primary care, we've now changed the incentive for the doctors to, instead of having to see a patient in order to get paid, we get paid to keep you well. If we keep you well, we see you less, which is less work for us. It is a fee for value in a sense. We want to provide you value. We want to provide you same-day appointments, 24-hour access to your provider. We want to coordinate care outside of our offices. And we want to form a strong relationship with a patient so that we can affect your life and keep you away from the high-cost ER or high-cost hospital-based care, specialist-based care, because we are providing you good care at the primary care level. For example, if you're a Medicaid patient right now, if you're lucky enough to get an appointment with a physician, you'll wait, as I mentioned before, or you probably won't see a primary care physician. You'll just go to the ER because they advertise 30 minutes or less. You then go to the ER, the emergency department specialist admits you. There's a charge for that. The hospitalist then cares for you as you're admitted in the hospital. There's a charge for that. If you have diabetes, you'll probably have an endocrinologist, pulmonologist, maybe a renal specialist, all developing charges along the way. And then you'll be discharged in a couple days, and you'll go home without any real improvement in your condition long term. With direct primary care, those Medicaid patients would come to us. We'd be able to spend 30 minutes, 60 minutes, if possible, really getting to the root of the problem, bringing in outside services if necessary, so nutritionists, mental health, physical therapy, and oftentimes it's said that the diabetic patient, or Medicaid patient with diabetes, it's not a factor of them getting an A1C test. For them, the biggest part that would improve their health could be just a ride to the doctor. And if we have a strong relationship with that patient, and the doctor can call up that patient and say, we haven't seen you in a while, why don't you come in, or what's going on in your life? The patient might say, I can't come in to see you. That doctor potentially could make a house call with a direct primary care model. It's been successful in other parts of the country. Q Alliance and Iora Health are two other examples that you should take a look at. It has been successful in low-income parts of the country. You can look at Atlantic City. Dr. Fernando Poulet of Iora Health did this in Atlantic City with a low-income population and showed tremendous benefits in quality of care, service, and lower cost. If the state embraces this model, it will be a model for the rest of the country. It would be a great example to set as a state, showing that we are a true innovator, And we'd unleash the power of physicians, we'd unleash the power of entrepreneurs that would all flock to the state, looking to improve our healthcare system, improve the care of our Medicaid patients, improve the care of all of our citizens. And for a governor that wants best value for money and calls our citizens customers, we would hope that he would latch on to the direct primary care concept because it is better value for all of us. Thank you.
Is that the end of the formal part of the presentation here today? It's just about 10 minutes after. I think there are going to be a number of questions, and we also have a number of cards turned in either in support or opposition of 459, Senate Bills 459 and 460. We're going to take a 30-minute break and come back here